we should start.
Yeah.
Hello, everybody. Welcome to the third webinar that we do related to the Ontario Health Teams. Just to give you a background on what's happening, the timelines, what's next, and where do we go from here and how you can get involved. At any point during the webinar, feel free to send questions. Sitlali, who is sitting to my left, is will put her hand up. So you do not need to wait till the end to ask questions. You can ask at any time, and I will stop and address your questions. And then at the end, if you have additional information that you are aware that we are not aware, by all means, please share with us. So first, let's go again through the Ontario health model, which I think we looked at that in the past and you saw it. Ontario Health Agency, then the 6 what's called now legacy agencies that will merge into the Ontario Health Agency, and then 5 regional offices, plus the Ontario Health Teams and 10 public health entities. Let me first go through each one of those layers. So the Ontario Health Agency, acting CEO of the Ontario Health Agency, Suzanne, sent an email already with who are the partners, who are the people that will help her do the various transitions there. And we can absolutely share the email from Susan Fitzpatrick with you. But let me tell you a bit of who is leading what, who is moving to help Susan with that transition. First of all, she has individuals from the various agencies that have joined her senior management team, clinical leadership and quality program, Irfan Dalla from Health Quality Ontario. For communications, Jennifer Shipper, who also is joining her from Health Quality Ontario. Digital and IT, Angela Tibando, who is joining from eHealth Ontario. Finance and Admin, Elham Rushani, who joins from CCO, Cancer Care Ontario. Human Resources, Manson Lockey, who joins from Toronto Central Health Link, who work with Susan in that capacity. Legal Governance, Scott McHershen, who joins from the Ministry of Health. And Strategy, Stephanie Loken, who joins from the Toronto Central Link as well. So Susan Fitzpatrick, the interim CEO, has formed already a group that will help her with the merger of the legacy agencies into the Ontario Health Agency. In relationship to that, people ask, and we have asked also Susan, when and others, when will that merger happen? And it really does not depend on Susan, but depends on legislative and regulatory changes that come with the Connected Care Act that will come most likely this fall. And only then the legacy agencies will get a notification and will start to merge into that, as well as the LINs. That's when the LINs really will cease to be LINs and will become legacy LINs. In addition to that, let me move then to what I hear will be the first agency that will move forward. From what I hear, will be Cancer Care Ontario, which is the largest of the agencies. Whether that will stay the case or not, time will tell, but we will keep you informed. Everything that I have said so far is accurate and is information, and some of that you will see in my next column on the journal. Some of that not because we received after the journal went to print, but I will keep informing members through the journal about anything that we know. The regional offices from the Ontario Agency, from the Ontario Health Agency, will take place likely in the fall. And then we move now to the public health units. The public health units, there is a lot of conversation. First, there was with only a select group of chief medical officers and the association. And we have insisted quite repeatedly that the chief nurse officers also need to have a consultation, and I am delighted to share that Helen, the deputy, will be meeting with the chief nurse officers, and that's excellent because they need to be informed also by what the chief nurse officers have to say. Moving on, one of the key elements of this entire change is to respond to the quadruple aim, and the Ontario Health Agency will be driven by that, and our work at RNAO responds to all of this and supports all of this in quite a beautiful way. So the issues of, for example, improve patient outcomes, needless to say that the BPGs of RNAO have a critical role. All of the BPGs impact on clinical and patient and health outcomes. And quite frankly, they also impact on the other triangle to the left, which is lower cost of care. Because if you have less falls, if you have less injuries after a fall, if you have less pressure injuries, if you have more and better breastfeeding, if you have etc., you are lowering in a positive way the cost. Where we will be very attentive is that we don't move into lowering the cost by cutting staff or by thinking that replacing RNs with other people is a way to lower the cost, and is something we are watchful because where is appropriate is appropriate, where it's only because of lowering cost, then that's not appropriate. For both of those triangles, the light blue and the darker on the opposite side of improving patient outcomes and lowering cost, you absolutely need to have both improved patient experience and improved provider experience. The triple aim used to talk only about three of these elements: improving patient outcomes, improve patient experiences, and lowering the cost. The quadruple aim introduced improving provider experience, because without the positive engagement and providing experience, really, many of these things cannot, quite frankly, happen. Here is where also the BPSO experience is so positive, and you will hear more about this. And it's because we see a tremendous level of engagement and excitement in our BPSOs by the process that we use to be a BPSO, and by the process of engagement that BPSOs have with their organizations. So that's important to keep in mind, that it's not only the BPGs, it's not only the policy work, all of that absolutely is also the way that we go both at RNAO and specifically on the BPSOs to engage with people. Here is where your role, as in some of you that are participating as BPSO lead, is very important, and where we don't see that role being strong, I will be meeting with CEOs and presidents of organizations to strengthen that role, because quite frankly, they're approaching us, and you will see that in a minute. So here is the Ontario Health Agency. You can see that on the website also. This is what Ontario Health Agency is intending to do. And here is where you can see already how some of our elements align very well with the goals of where the Ontario Health Agency is moving. And here also one can think about digital first approach with order sets from the BPGs and other elements, the background that we have on health records, and of access to your personal health record will be very important also to contribute. And we will be developing one-pagers so that we can put them in the website so people can take advantage of the assets of RNO. The vision for the OHTs are again posted on the website, but suffice to say that the goal of the OHTs is to offer a positive experience to people that need health services, both in a preventative way, in a health promotion, disease prevention way, as well as in a curative way when that is necessary, or palliative way, or end-of-life care when it's necessary. And it is by wrapping around services around people. You will not hear the OHTs speak about specific doctors, nurses, midwives, etc. They will speak about the experiences and the results that people need as users and owners of the health system. So that's very important for us to understand, and it's very important to us to contribute in the ways that RNO very uniquely is positioned to contribute. 4 steps, nothing new here, to becoming an OHT. The red indicates where we are on those 4 steps. The self-assessing readiness, where people filled in questionnaires and applied. The validation provider readiness, which is where we are now. Becoming an Ontario Health Team candidate and becoming a designated Ontario Health Team. That's what will happen next. And I will give you in a minute the timelines and how we have been involved on all that. First of all, it is important that you know, for those of you that didn't participate in the first and second webinar, that RNO did see the OHT document ahead of being released. And quite frankly, I was overly impressed, and I would again recommend that you, if you haven't, that you read that document. It's a good, solid piece of work, and I haven't seen lots of pieces of work solid as that. In that context, let me tell you that from a policy perspective, RNO, under the leadership of Joy Dawkins and Matt Calway, our Director of Policy, we are working together on a comparative analysis between the OHTs and the ECHO. You do know that we did release years ago into 12 ECHO number 1, 1.0, into 14 ECHO 2.0. This will be ECHO 3.0. And interestingly enough, you will start to see the very many similarities between what we even said in 212 and what we are seeing now in the province. And hopefully at some point, we will get to what we believe it should be anchoring the system, which is more in the community care, public health, primary care, home care, more than, and using hospitals, of course, always we will, but for what hospitals are necessary, not to be the canary in the mine where everybody goes to the emergency room because basically they have nowhere else to go. So with that in mind, here is what happened. In May 15, which was the deadline, 154 applicants sent their self-assessments. We were asked by many of our BPSOs to provide support letters, which we did. Last week, I forgot the day because I don't remember, it's all a big blur. On Wednesday, the groups were called, all of them that applied, and 31 of them were told that they are invited to move to the next step in submitting a full proposal, and 43 were invited as in development. Several of the ones we provided letters of support made the cut to the first 31 that are invited to submit the proposal, and a few others to the in development. And we will tell you how we are involved at this point. The next step is that they will provide a full proposal, and well, I wanted to give the deadlines, but here we go. Here are the deadlines. Then we will go to the picture. And the deadlines are that on October 9, they will provide the full applications. And in the fall, soon after, the Ontario Health Team candidates will actually be announced. I think I was pretty good at predicting 30, not 31, but 30 for the early, for the proposals. I actually thought that there were 170 submissions. Here you go, overdid that there. But I do think that actually from the 31, likely 30 or 31 will be accepted if their applications are good, and I have no reason to believe they're not. We do need to understand that the level of maturity in terms of the capacity to implement evidence or the capacity to engage in an authentic way will vary, the same as it varies in our BPSOs. When we accepted the first 7, yeah, they were all 7 stars, and then when we accepted 21 more, they were all stars, but there was variation between, and that's the case to this date, whether in Ontario, nationally or internationally, and people mature through the years because they learn to work together. The beauty here is that before this happened, really, when I look at our work, BPSOs were working together, but even within their organizations, like this cross-sectoral thing that we're seeing is a phenomenon that is extremely positive for the patient outcomes at the end of the day. Let me move back to that picture that is so beautiful there. So we did get a request by a few of the applicants at the time to meet with us to see how they could leverage the BPSO, both the BPGs, the actual BPGs of RNO, as well as the BPSO process, how they could leverage to benefit the work that they were doing. This is public now because many have tweeted about that, including Barb Collins, the CEO of Amber River, who was the first one approaching us. And the beauty at the meeting, and these are all people, except of some of us that you can see Heather there and me in the corner, the rest are all people from the BPSO, sorry, from the OHT, that is led by Black Creek Community Primary Care, by Seidel East Home Care, by Humber River Hospital, by, I'm looking to see if I remember all the rest, by Costa Health, by West Park Healthcare, by Luma Care, by Villa Colombo, by Runnymede Healthcare, Addiction Services for York Region, Unison Health and Community Services, and maybe I'm forgetting some, but those partners met with us at RNAO, and what I found most inspiring, because this was before the announcement, this was 3 weeks ago, what I found most inspiring as they were determined in saying, we want to continue this work together on BPSO across the board, and selecting 3 BPGs that are the same for all of us all the time, regardless if we are selected as a full applicants. We want to continue that. So I encourage all of you. I see in the call many people that I know are part of applications. Holly, I saw that you were registered for this. I see many of other people. And I suggest many of you are BPSOs. I see Kathy Dilworth for Toronto Public Health. Many of you that are BPSOs, I strongly recommend that you take this on and that you do help and meet with us and with teams that you are working so that you get ready either for this application or next application, or simply because it's good practice to work together with other partners with whom you connect. I think will do you well, will put you in good standing. I see also Lori from Niagara Health System. I know, Lori, that because we gave a letter of support, that you are one of the ones that also was successful. Again, don't wait for us to invite you. We are not inviting people, so come to us. If you want to become one of those OHT VPSOs, we will be thrilled to come to your region. Heather and I will come and work with you in supporting you. This will do two things to your both applications and future work. One is, how do you ensure that, for example, the 3 VPGs, because that's what we are expecting from the VPSOs that are OHTs. So one of the VPGs will be transitions of care. In the case of this specific OHT, they chose falls prevention, pressure injury prevention, and actually they're talking about the fourth one, person-centered care, to become their 4 VPGs that will be implemented in absolutely all the sectors. You save yourself 2 things. You save yourself to need to run through an RFP. That's number 1, and that's no small feat. You do not save yourself from signing an agreement. We are doing an agreement with the OHT as a whole, but then for Inquire, with each specific organization, we need to do their separate agreements. But it's less competitive because you already were in the competition of the OHT. So you don't need to be run twice through the competition. Our job for those OHTs that want to use the VPSO approach designation VPGs in a systematic way, our approach is that we are here to support you. We are here to make you shine, and we will do all that is necessary to do so. So that's the first one. With them, we are developing already the agreement. It's not a 10-page agreement. It's a 3-page, I believe, that we send them today agreement. Not all the partners in the OHT need to agree to sign. In this case, they are, but not all of them need to agree to sign. If 70% of them agree to sign, those are the 70% that will participate in this, and the others maybe will join later, or maybe not. It's up to them. So you don't need to feel that it's mandatory that all of them are part of it. And then those of you that are already VPSOs will serve as support. So not only they will get the support from Heather and myself that will be joined by the hip on this, but you will get the support of local people that already know how they're doing that. You will get the support of their coaches that are local, right, from RNO, that are their coaches. You will get the support from the LTC team if there is pieces that have to do with LTC. Like, you simply gain more supports and more content to make your story very successful. This will be a top priority for RNO, making the OHT successful, because at the end of the day, thank you so much. At the end of the day, it is not only the job of government and the funding that government provide. At the end of the day, quite frankly, it's all of our responsibility to make OHT succeed. If we think they're a good thing, and at RNO we think they're a good thing. So let me tell you about other supports that the OHTs will have. They will have what they're calling compendium activities. So first of all, one compendium activity I already mentioned to you is the integration of all the legacy agencies into the Ontario Health. I already mentioned that to you, and I mentioned that for that we need legislative and regulatory changes that will happen in the fall. They will have a second piece that is called Digital Playbook. And that digital playbook is basically what's the digital supports and the digital investments that will be done for them. And then shortly after, I believe that shortly after in the fall, we will see a full strategy for this digital playbook. This is where we need to connect probably the order sets also for those of you that are OHTs and that are VPSOs, or want to be OHT VPSO, as we seem to be moving to call them. And they will have other supports for issues of governance, issues of integrated care, issues of, I'm trying to say it without saying what it is because I'm not allowed because I'm involved. So here you go. There will be more work that will be in terms of support systems at the level of integrated healthcare systems, what makes them successful and what makes them effective. So that's very important. And we play a role also on the issue specifically of evidence-based practice, evidence-based guidelines, and the BPSO approach with the development of a new toolkit. Well, it's not a new toolkit, it's the third edition of the Knowledge to Action Toolkit, which we already know. You have used that as BPSOs, those of you that are BPSOs, and those of you that are not BPSOs, it is on the website, the Knowledge to Action Toolkit. And we are adding to that a social movement action approach, which will be a parallel framework with the Knowledge to Action, which will lead change forward, and it will be greatly used in the province and also in other agencies like CPSI. Together with that, we are bringing it forward sooner, whatever is the word. We are prioritizing the BPG on transitions of care to begin the work this year and to be released in 2020, because transitions in care will be no doubt one of the KPIs for Ontario Health Teams, meaning that people have, the public, the patients, have a smooth experience through the system, and also that they don't fall through the cracks. And that also has to play with the issue of care coordination located in primary care to help those transitions in care happen. But still, you need the knowledge base, right? You need the evidence behind what works in transitions of care. So the combination of care coordinators moving to the community, hopefully primarily to primary care, as well as the evidence-based BPG on transitions of care, as well as the leading change, will have a tremendous impact, we believe, on the work of Ontario Health Teams, especially on those that are BPSOs, because transitions of care will be a mandatory BPG for Ontario Health Team BPSOs, the two clinical one or health one. They can choose, but not the one on transitions of care. So those are the timelines. We mentioned that to you. In the fall, they will be announced. And then the second round of Ontario teams will come on December. And we no doubt will be involved. We know already some of those. And in fact, with those, we should start the BPSO OHT way more in advance. We already started here in advance. If you think they will be announced only in the fall, and we are already moving ahead, right? The others we should start soon also. So if any of them or any of you want to approach us, absolutely yes. A question came to us from this first Ontario Health Team BPSO that they ask us if they can use the learnings from here to use on other Ontario Health Teams that they're involved. For example, you, Holly, you were not the one that asked the question, but Saint Elise did. Because Saint Elise, like you, Holly, likely are involved in several Ontario Health Teams. So Saint Elise rep asked, can we use what we learned here for others? And actually people from other sectors that are involved in several Ontario Health Teams had the same question. The answer is absolutely yes, always, always. Now as a BPSO, not OHT, tomorrow as a BPSO, OHT, and 10 years from now, with whoever you want in Ontario, Canada, or abroad. This is your knowledge. We're only gifting you with that knowledge. You get power to do what you want with that and use it as you see fit. So let me stop there. Next time we don't need to put the picture. And if we put the picture, let's put the entire thing. Let's open for questions. I don't know if you have any.
No,
but if people have questions, not only questions, if you have more information that you would like to share, this is fantastic if you can share it, because this is how we gather our intelligence and how we can enrich our common understanding of what's happening. Maybe I will ask a question. If you can send a note of, if you can send through the chat box to Citlali, how many of you are involved, first of all, in Ontario Health Teams? How many of you are involved in Ontario Health Teams? If you can say me and your name so we have an idea, that will be great. The second question, well, I will stop with one first. If not, they will not be able to answer. Oh, thank you, Esther. Esther said you can read it.
Esther says, excellent overview, thank you.
So Esther Mogahan is the Chief Nurse Officer at a Public Health Unit in Ottawa. Thank you very much, Esther.
So Julie Smith says, South Lake is part of OHT.
So South Lake is a fantastic BPSO we have. If I am not wrong, and slap me if I'm wrong, Heather. The president and CEO, Lynn, is a nurse. Am I right? The COO at South Lake is a nurse. And I dare to say the finance person might be a nurse too. So kudos to you. And I suggest that you bring to your president and CEO and to others on your team. We are going to take, I should have said this and I didn't, we are going to take probably anywhere between 3 to 5 maximum BPSO OHTs, simply because we want to make sure, as always we do, that we get it right, right? So with this first one that you saw the picture, we are doing the contract, we are shaping the contract together, we are co-creating which VPGs will be used, we are consulting with them, we will be working with them and Janet Squires, who is our lead researcher in a comprehensive evaluation. So inquiry is one piece, but what other evaluation? Evaluation about formation of an Ontario Health Team, etc. So if some of you wish to become the second, the third, the fourth, and the fifth, by all means, in my view, the sooner the better, because it will put you in good stand, but more importantly, it will do good work for your area. Maybe Heather, you read the questions and I
sure. Yep. So we've got FJ Davey is part of the Algoma Ontario Health Team, and hi Carrie, good to hear from you. And we have a question, Doris, about the role of the regional offices. Would you be able to comment on that?
Yeah, I can comment with the crystal ball.
Oh, okay, that's fair. Yep.
Yes. I think the role of the Ontario Health Agency will be really to, well, if I was Susan, and it might not be Susan at the end, right? Fitzpatrick, she's interim. But of that board, let's say, would be to take the best of each one of the legacy agencies, sharpen the role of the legacy agencies into what will be the role of the Ontario agency, set common ends or common goals that they want to achieve for this province from all the perspectives of access, of quality outcomes, of et cetera, et cetera, et cetera. Create general standards, which then you scale down to the Ontario agencies, and the Ontario agencies are really your central local authority for those Ontario health teams, so that they connect. Another question is what will happen with that and the public health units. So depending if there will be 10 or more, I do think at the end of the mandate of this government will be 10 or 12, no more, unless Mr. Ford had the transformation. But remember, previous reports said 14, previous government. So I do not think by any means of imagination you will have more than 14. They will need to work with the various medical officers of health, right, and etc. But I think you will see 2 or 3 per regional office, right, to provide that oversight from a public health perspective of population health, of emergency preparedness also, which imagine, right? So I think that that will be probably the role. And then the Ontario health teams will be the actual doers of making the whole thing happen, because if not, nothing will change for patients. And that was the problem of the LHINs. The LHINs got into doing everything. They really got into doing everything. The local, whatever they were local ones, they didn't develop fully. And never it became an interprofessional, intersectoral practice. Very, very little, right? So I tip my hat that it seems to be going there. Yesterday we had the meeting of the Ontario Primary Care Council, and we did have the benefit of Mel Fraser, who really is the ADM running a lot of this, speaking with us and presenting to us. And one of the questions was how long it will take. And she also said, I'm talking from a crystal ball. And she said likely 2-3 years. So no one is thinking here 20 years. And I tip my hat, because the biggest problem with all of these health system transformations is that they take way too long. And then a new government comes, or the same government with a new minister, or the new government, whatever it is, new premier, same party, and everything changes again. And it's a lot of money, taxpayer dollars, and time wasted, and goodwill of people. And on that, I want to speak, because there is a lot of goodwill by agencies that are working together, by health providers, associations, associations that are getting involved. Well, let's not waste that energy. Let's make it good for the people that at the end of the day need to have the good services, not for the various positions of whoever and whoever. Yes.
Yep, and we just got a couple more comments here.
If we didn't answer the question enough, please insist that we do. Okay.
Okay. We're continuing to get feedback from participants about their applications. So Bayshore has applied to be part of several.
Fantastic.
Ontario Health Team.
You need to know, Holly, and you can ask Matt that was there at the meeting, and a few others that were there at the meeting of the OPCC where Melanie spoke yesterday, and many other people of the ministry came, that I gave 2 examples, because we were talking private sector and public sector, and I said we have PPSOs. Example, I said home care, St. Elizabeth and Bayshore, and they're doing outstanding work, so please know that. And I also said that Bayshore is implementing the guidelines across the entire country. What I didn't say, and I should have said, Holly, but I didn't want to say it because I don't think it's a good thing, is that your boss has 1 chief nurse for all that mega work. And I tip my hat to you, Holly, for all the work that you do with your team.
We've got another question, Doris, here in reference to the e-health bucket. And it looks like, maybe just by being on the model, but it looks like it's on its own. And the question is, will it tie into a regional office?
The e-health bucket, it is up there in the Ontario agency.
Yeah. Let me just
so the e-health bucket is right there. E-health, at the center. So the e-health, if you see CCO, Cancer Care Ontario, HQO, e-health. E-health is one of the legacy agencies. So a few things about e-health. E-health will become part of that. All of these agencies, well, they will not be agencies anymore. They will be buckets, really. But they all will shrink because, and they will shrink because they ought to shrink. In this case, I don't want to say they will shrink because they want to save dollars. I'm sure that too. But when you had HQO that started with whatever it was, I was at that table, 44 people, and now it's 300. Granted, they merged some agencies, but still 300. CCO over 1,000, e-health I hear even more than 1,000, etc., etc. They will shrink, and they hopefully, and I say that with respect, need to sharpen their mandate. Because sometimes we're tripping over mandates between what the government does on standards, what the etc., etc. In terms of evidence-based practice is one example where there is not always sufficient sharpness of who does what and where. So e-health is there.
And just another comment, again, continuing to get comments from people about their role in OHT applications. And so SE Health, St. Elizabeth is also participating in several.
Yes, yeah, I'm aware, and that's fantastic. Fantastic.
Nan just commented also that VON is also participating in several.
Fantastic, fantastic. So VON, St. Elizabeth, well, St. Elizabeth is involved now in the Ontario Health team that we are working with, BPSO. But if Bayshore wants to speak with partners in whichever that you are working, that is either in this round or next round, please go ahead. You don't need to be only in this round. If a VON wants to join with your partners, absolutely yes, please. Absolutely yes. I just want to repeat, we are going to take 3 to 5. It doesn't matter to us if you're in the current one. We are delighted that at least one of them is in the current one, because in a sense pushes us to develop the joint proposal and all those pieces that others will benefit from. And the others of you, whether you are in the home care sector or in primary care or in an NP-led clinic or in a long-term care or wherever you are, hospital, etc., because South Lake is also here. If you want to be one of those, again, please let us know sooner rather than later.
No.
And the contact person for becoming an Ontario Health Team BPSO is please email me, so you can put my email, and please copy Heather and PG. And we will move on 2 things, depending on the number of requests. We will move either on first come, first serve to simply be fair, but also on capacity of how those current BPSOs that are there have progressed, right? So that, you know, those current BPSOs, whether you have finished or not, because take an example, St. Elise was a founding BPSO, but HRH, Humber River, is in their 2nd year, but they're doing work like in the 5th year, like they're doing amazing work, right? So to us, it's not only the years that you're a BPSO, but your performance as a BPSO so that you can support others in doing the work. But don't shy away from asking us, because we will help one way or another. Other questions? So the next webinar is on.
It's coming up quickly, actually. Let's check and see.
So
maybe PJ can tell you.
it's right here.
And we should put
So the next webinar is happening on August 9th from 1 to 2 p.m.
August 9th from 1 to 2 p.m. Feel free to bring anyone you want. We will send it out to all members, so all members can participate and they're in the know. If you want to bring people from other professions because they're not members, or if you want to bring some of the people that are your partners in OHTs because they don't have access within their profession or within whatever to this type of information, if you think that this information was helpful, bring whoever you want. This is not a closed door shop. Okay? So thank you very, very much, and stay tuned. Please don't criticize too much the column that will come in the journal. It was before I knew some of the latest, so I did announce that they will know soon about who they are, but it was soon. By the time it went to print, it was soon, and it became. But that's good. It's good. It's also good to know again that some of the feedback that we give, for example, one of the feedback we gave early on, and we insisted again on a meeting we had with Matt, myself, and the deputy, and several of the directors, was the number of OHTs, and we did say a larger rather than smaller number, so we can learn from that. We also said at that meeting that it ought not to be only OHTs that are comprehensive, completely for the region, but it could be specialty OHTs, and CHIO is one of them. And in fact, I spoke about CHIO specifically at that point. I think we have the ear of those that are making decisions. We meet with them often. They ask us questions often, and I hope that that will continue to be the case. And now that we are going to leverage also on the assets of RNO to support the performance of these Ontario health teams, it will only get better and better for all of you guys. And if in the process we also position nurses, that's fantastic. We also need to open the doors to other professions that don't have the strength or the capacity to deliver what we are delivering. So please open the doors to anybody you know. Okay. Thank you very, very much. And feel free to send us feedback. Feel free to send us questions. If you can put my website there, my email.
Yeah.
And Heather.
And Heather, yes. And PG.
Fantastic.
Yes.
Fantastic. This is great, guys. Thank you so much for joining us, and thank you for the work that you all are doing and for taking this on and becoming engaged. One last question. Can you send a quick note to Citlali if you have been involved in the 3 webinars, in 2 webinars, or if this is your first? If you can quickly, before you disconnect, send that to Citlali. We will not criticize at all. We just want to see the need of the webinars, for how many people this is important, that we should be doing them once a month and continue, etc., etc. So if you can send that feedback before you disconnect to Citlali, that would be fantastic, okay? Don't disconnect so they can send the feedback, right?
They're all here.
Oh, beautiful. Fantastic. Fantastic. So Esther, I just want to close by saying how thrilling it was to come to your public health nurses, the chief nurses, the CNOs gathering that you had, that all-day meeting, and how thrilling was to open the appetite for them to get more and more engaged. I know they have a champion in you and your colleagues, but it was good to be able to really nurture that and fire that up. So glad that you are meeting soon with the deputy, and all the very best. And if you need any help, let us know. And that goes for any of you in any sector. Anything you need, please know that we are here to support your work and to make you a success story. Thank you very much.